So we're going to briefly refer to joint swelling because it's such an important sign to evaluate. Let's recap for a moment. Here we're looking at bone, and we get the articular cartilage at the ends of bone. We have the synovial fluid, and then we have the actual capsule of the joint with the tendons and muscles outside the capsule. This is a normal joint, and when we actually go to, for example, a diseased joint that we, for example, get with osteoarthritis, here we have bone again. Now we have basically degeneration of the cartilage with basically gaps down to the actual bone itself, with bony erosions and sometimes with subchondral cysts. And we can see the cartilage here is eroded as well. And when this happens, we get thickening of the actual capsule, diminution of the joint space, diminished synovial fluid, and we then get osteophyte formation, which is projection laterally of the edges of the actual bone overlapping the joint itself. It's also important to bear in mind that the synovial fluid is the medium through which cartilage is nourished. Cartilage does not have a blood supply or a nerve supply, and all the nutrients that actually keep cartilage healthy come from the synovial fluid itself. When you get joint inflammation, and this is an important differentiation, with osteoarthritis or degenerative arthritis, it basically involves the articular cartilage. As we can see here, you get degeneration of the cartilage. Inflammatory arthritis involves the capsule of the joint, where you, for example, in rheumatoid arthritis, this is where the primary pathology occurs, which leads to pannus formation. The pannus formation then causes destruction of the cartilage, altered synovial fluid, and abnormal pathology in the joint, leading to acute inflammatory arthritis in the joint. So osteoarthritis involves the articular cartilage, inflammatory arthritis involves the capsule of the joint, leading to destruction of the cartilage. Okay. Finally, when you actually have a swollen joint is really only due to 4 reasons that you can have it. Firstly, if you have synovitis or inflammation of the actual capsule, you get excess synovial fluid, leading to a swollen, sometimes tender, boggy swelling of the joint. The other reason why you can get a swollen joint is if you have pus in the joint. Thirdly, if there's blood, leading to hemarthrosis. And fourthly, where you get osteophyte formation, which we'll see later, where you get the bony projections here at either side, leading to actually destructive changes within the joint, etc. So the 4 reasons why any joint are swollen are increased synovial fluid, pus in the joint due to septic arthritis, a hemarthrosis, or osteophyte formation.